Hey, Dr. Huntington here, and in today's video, let's look at how vitamin E affects your heart, as well as the best foods to eat so you get plenty of this essential nutrient. Okay, so you've probably heard of the importance of vitamin E, as it relates to like anti-aging, as well as the fact that it's a powerful antioxidant. But what most people don't know is that vitamin E can reduce your risk for heart disease, by as much as 25 to 50%. And it does this from several angles. First, vitamin E reduces inflammation and reduces the harmful effects of LDL cholesterol, which is commonly referred to as the bad cholesterol. It does this by fighting free radicals, which are what cause LDL cholesterol to oxidize, and lead to the hardening of blood vessels. And of course, when blood vessels harden, it restricts blood flow and increases blood pressure, as well as your risk for heart attack and stroke. In fact, the damage caused by free radicals, which is called oxidative stress, puts you at risk for all sorts of other problems, including diabetes and cancer, degenerative brain disorders, and all the visible signs that you commonly associate with aging. Now, one way to avoid, or in some cases delay these problems, is by keeping this oxidation process under control. And you can do that by eating a diet that's high in antioxidants. And of course, vitamin E is a chief antioxidant. Vitamin E also helps your body use vitamin K, which is like another fat-soluble nutrient. Vitamin K is crucial for blood clotting and bone health and maintaining blood calcium levels. One of the jobs of vitamin K is that it directs calcium in your body to where it's supposed to go, mainly your bones and your teeth. And vitamin K keeps calcium away, from the places that you definitely don't want calcium building up, like in your arteries or other soft tissues. Now, one of the keys to a healthy heart, is your body producing enough nitric oxide. This is a molecule that's made in like almost every cell in your body. And what it does is it expands blood vessels, increasing blood flow. And it decreases plaque growth and the clotting of arteries. So, your body's ability to produce nitric oxide is key to your cardiovascular health. What vitamin E does is it helps to ensure that your body can maintain high enough levels of nitric oxide, which in turn keeps your blood vessels open, giving you good circulation. Now, unfortunately, nitric oxide is destroyed quickly by free radicals. So by eating lots of antioxidants like vitamin E, it helps to keep nitric oxide levels up. So some good dietary sources of vitamin E include pine nuts and Brazil nuts and hazelnuts, as well as almonds and sunflower and pumpkin seeds. Avocado is a great source. It's absolutely one of my favorite foods. Mango and blackberries and kiwi, as well as red sweet peppers and broccoli, leafy greens, and then get into seafood here, trout and salmon and lobster. And if you really want to get like really adventurous, in seeking out your vitamin E, you can also eat things like sea snails and octopus and crayfish and fish eggs, which of course I guess sound much more appetizing when they're on a menu and they're referred to as roe or caviar. All right, so hopefully now you've got the connection between vitamin E and the health of your heart. And for those of you who choose to take a vitamin E supplement, which is a good idea for most people, you want to ensure that your vitamin E dietary supplement contains all 8 vitamin E compounds. Most of the vitamin E supplements that are sold today only contain one of the 8. So it's important to check your label. And if you want to see what the label should look like, just go to BodyManual.com and look up the product called Full Spectrum Vitamin E. That's the dosage I recommend. And again, you can see what the label will look like when it contains all 8 of the vitamin E compounds. All right, so if you've enjoyed this video, make sure to click below to subscribe to my channel. All right, I'll see you in the next one.